Hi, I'm Dr. Steve Mascarin from the Family Dental Center, and welcome to this edition of Smile, Life is Good. Today we're going to talk about the domino effect of missing teeth and why if you're missing one tooth, you need to get it replaced as soon as possible, because one tooth very quickly turns into two missing teeth, 3, 4, and as time goes on, dentures, you miss all your teeth. Missing one tooth, it's like dominoes. Everything around that tooth shifts towards a space. The tooth behind it shifts forward, the tooth in front shifts back, the one on top shifts down, and before you know it, a whole side of your mouth is involved. It's the simplest and easiest thing to do to replace that one tooth before that domino effect happens. Now, replacing the one tooth is very simple. There's 3 choices basically. Get something that comes in and out, which is what a partial denture is. You get a bridge, which you cut down the teeth on either side and put a porcelain bridge in to fill the space in, or you get an implant. Now, with recent advancements in implant therapy, it is long-term far less costly and a lot easier and far better to get an implant to replace that single tooth. And long-term, like I said, the most inexpensive thing you can do. Now, if you look at the pictures that are up on the screen, having a partial denture may be a little less expensive initially, but to have something that comes in and out of your mouth is very uncomfortable. A lot of people won't even wear it after it's made, so it's wasted time and money. And it does affect the neighboring teeth because it's anchored onto them, so it picks up plaque and tartar, and it clasps onto the teeth. It's not very attractive. It's a constant reminder that you have false teeth. So that's what a partial denture is, okay? So if you can avoid it, avoid it. The next choice above that is something permanent that doesn't come in and out, that looks and feels just like your own teeth. However, it's called a bridge, porcelain fused to metal bridge. It covers up the teeth on either side of the space. So if you're missing one tooth, this tooth is prepared and skimmed down. This tooth is prepared down about a millimeter, millimeter and a half. So all of a sudden, for that one tooth, you've involved 3 teeth. And the lifespan of a bridge is generally 8 to 12 years, at which point it either needs to be replaced or those other 2 teeth have become involved. So it ends up costing, again, more time, more cost to the health of the neighboring teeth. The best thing to do, and I'm sure you know that I was getting to this, is an implant. Putting an implant in that space to replace the tooth doesn't touch the neighboring teeth. It stops the domino effect from happening. It's easy to take care of. Brushing and flossing doesn't get decayed, doesn't get gum disease, and it's every day that goes by it gets more simple and simple, and there's more advancements, more technology. It's a relatively simple procedure, and long-term far less costly and less time-consuming. So in closing, if you're missing one tooth, get it replaced before it turns into a whole mouthful of missing teeth and a denture. And again, the simplest thing, get an implant if you can. If not, choose one of the other options, but get it replaced. I'm Dr. Steve Mascarin from the Family Dental Center. Thank you for watching, and smile. Life is good.